When we think of involuntary treatment, whether it's psychiatric or medical, certain rules must apply. For psychiatric involuntary treatment, for you to be placed into a psychiatric hospital against your will, the first thing that must apply is that you must either be A, mentally ill or disabled. That is not enough to get you into a psychiatric hospital. How many people do we see walking down the streets talking to themselves, and you know there's definitely something wrong with them? So why don't the police come by, round them all up, and put them in a psychiatric hospital? Because they have to meet certain criteria. Not only do they have to be mentally ill, but they must be either A, a danger to themselves or suicidal, B, a danger to others or homicidal, or C, gravely disabled. If you assume all of those criteria, then you can be held against your will in a psychiatric facility. Once in the psychiatric facility, patients still have the right to refuse treatment. So if you refuse treatment in the psychiatric facility, then I would have to go to court to have the judge grant me permission to treat you against your will. However, what if in the psychiatric facility the patients become dangerous to others, or the patients become dangerous to themselves, meaning they're suicidal, they're homicidal, they're assaultive? In those situations, then the law does allow you to treat patients either against their will for medication or against their will to be placed in restraint and or seclusion. However, what you're doing is that you're medicating and or restraining per incident. So you can't just restrain them as much as you want, whenever you want. It has to be done when the patients are either acting out against themselves or others. And the same rule applies for medication. So if you want more long-term daily use of medications, the patients need to approve this. If not, you're going to have to go to court to get such treatment. When we think of medical consent, of course, this must always be obtained, assuming you're awake and alert. Even if it is a life-saving treatment, the patients must consent. If it is emergency medical treatment, it can only be done when the patients are either unconscious or severely cognitively impaired. Those are the only two scenarios where you as a physician can medicate without getting the patient's consent. Everything that is non-emergency and the patients refuse, you must go to court, so therefore you need a judicial order to get any kind of treatment.